The United States, which is the hardest hit at the moment, as US President Donald Trump has tested negative for coronavirus for the second time as the COVID-19 deaths in the country hit a record high with over 1,000 fatalities in a day. Now, the number of casualties has now risen to 6,070 in the United States. Meanwhile, Donald Trump said that he underwent a second test using a rapid diagnostic kit that he had unveiled earlier this week.
I did take a test. It just came out. This is from the White House physician. You may have it. Just came out. I just took it this morning. And I took it. It took me literally a minute to take it. And it took me, I guess it was 14 or 15 minutes. I went to work. I didn't wait for it, but he said it took 14 minutes or something to come up with a conclusion. And it said the president tested negative for COVID-19. So that's the second one. I think I took it really out of curiosity to see how quickly it worked and fast it worked, and it's a lot easier. I've done them both. And the second one is much more pleasant, Jeff. I can tell you that. Much more pleasant.
So that was the latest press briefing coming in from the United States. Let's now quickly go across to our correspondent Jagriti Dave, who's joining us live from Washington, D.C. with more updates. Jagriti, a very warm welcome to you. Now, the death toll in the United States has, of course, set a new record with the highest number of fatalities. What were the key takeaways at today's White House press briefing?
Well, the key line from today's briefing was that the White House is expected to issue recommendations to all Americans to wear face masks, face coverings of some kind, which is a significant change, a reversal, in fact, from the current guidance. The CDC does not recommend that healthy people wear face masks currently. Now, the report suggesting the president didn't elaborate on the guidance, the recommendation yet. He said it's going to come tomorrow or over the weekend. There were reports that suggest that the guidance could only apply to Americans in hotspots. So New York would be the key example of that. But the president has talked a lot about people wearing scarves. It's not going to be mandatory. He said if people want to, they can. He's talked about using things like scarves to wrap around your face. And the guidance is suggesting that it's to protect other people. It's not to protect yourself, really, because there's always other ways of getting infected. In fact, Dr. Deborah Birx, who coordinates the task force, was very keen to say that there should not be a substitute for current social distancing guidelines. It could be an addition, but not the substitute. The thing that will flatten the curve is maintaining distance from other people and continuing things like washing hands, practicing hygiene and other things in those guidelines.
Right. And it's very interesting to note that how the authorities actually insisted on improvising as far as covering the face is concerned with material that's available at home, be it scarves or even using bandanas. Now, moving over to President Donald Trump, who's of course tested negative a second time as he announced taking the second test. In fact, he's endorsing this one by calling it fast and a lot easier. But he's one of the privileged few who could avail the test, Jagriti. And yet, how critical and challenging will it be to ensure mass availability of these kits in the United States?
That's a very good question. It was one that was asked to the president by a journalist in the briefing today. And what Dr. Deborah Birx said was that it was going to be made available to those who need it most. So those in rural communities, those Indian reserves here in America where it's difficult to get medical supplies fast. They're remote rural communities, people at risk as well. So there is going to be a rollout, but it's going to be amongst the most urgently needed communities first.
Right. Jagriti, now let's look at the epicenter, which is, of course, New York. The governor, Andrew Cuomo, has spoken about having roughly 6 days of ventilators in the stockpile left. What's being done to address his concerns, something he has been flagging for a long time now?
Yes, indeed. There's a concern really across the United States, but particularly in New York, the epicenter, about the lack of personal protective equipment and ventilators. You look on social media, you see heartbreaking pleas from doctors and stories that are told about the lack of personal protective equipment. And this is something that the White House is trying to address clearly in these briefings. They direct a lot of their comments to New York, talking about the thousands of ventilators, the thousands of face N95 respirators and face masks that are being sent to New York currently. But clearly the governor and officials there are saying that there is more that's needed. There's a huge spike in New York, and they are worried that they are going to run out fast.
Absolutely, and they better be focusing on the health workers also, since they are on the front lines. But we're also learning that Donald Trump's own company is seeking to ease financial crunch as coronavirus is taking a toll. How has the pandemic impacted the Trump organization itself?
Well, the economy as a whole has been affected by the pandemic. We have seen 6.6 million jobs lost in the last week alone. That's on top of 3.3 million job losses the week before, according to Department of Labour figures. So this pandemic is hitting everyone hard, not just from a health perspective, but clearly from an emotional perspective, but also from an economic perspective. Big businesses, small businesses, airlines, hotels, restaurants. Of course, the Trump family has, the Trump hotels are a big part of the family business. So a lot of, and the president talks about the hotel industry frequently, clearly something that he is close to. So, these are industries that have been hit hard. They've been shut down, many not deemed essential businesses. So they are shut down, and their employees obviously are at risk. There's as of tomorrow, the Treasury Secretary announced the rollout of small business loans, where these will be waived up to 100% if these businesses continue to keep on their employees. So there are clearly measures being put forward. This $2.2 trillion coronavirus relief package that the president signed off on very recently to put money, direct deposits into people's bank accounts. Questions asked about what happens if people don't have bank accounts. Well, they'll be cut checks, but the Treasury Secretary said that would take weeks, not months. Obviously, concerns that the money will not get to them as fast as direct deposits will. So yes, a clear hit to the economy and concerns there.
Right, Jagriti, and before I let you go, since we were speaking about the ventilator shortage, I'm also being told as we speak that Alice Wells has tweeted about cheering the Indian engineers who are, of course, with the support of MIT, building low-cost ventilators. Could this prove to be a potential breakthrough for the United States?
Well, the United States there are private companies in the United States themselves, like General Electric, General Motors, Tesla, Ford, many car companies who are changing what they do and producing ventilators instead of their usual cars. And so this is a big push within the United States for the production of ventilators. But the president has said that they are complicated things to build. Well, the United States is clearly looking at all options. They are not ruling anything out. They've accepted aid from Russia. They have accepted packages from foreign countries. So they are looking clearly within the United States and outside the United States. And yes, ventilators are expensive. The president has said they take a long time to build. So they clearly will be considering all options and all costings.
Right, Jagriti. Thank you so much for sharing all those details with us. We thoroughly appreciate your contribution, since you've been consistently on with the reportage with us on the coronavirus in the United States. We'll keep coming back to you. Thank you so much for joining us on this live broadcast.